When you think of colon cancer, you don't typically think of patients under the age of 50, but a new study just released last month talks about the increase in the incidence of colon and rectal cancer in younger patients. Now, we are learning more about that today. We welcome in Dr. John Garvey and Dr. Patrick Kenny with the Windward Digestive Health Center. Hello, thank you so much for joining us.
Thanks, Trini. Good morning.
So why don't we start with you, Doctor? Tell us about this new study.
Yeah, there's published at the end of February was a new study in the Journal of the American Cancer Society. And what it did was it looked at surveys called SEER surveys and looked at colon cancer rates from 1950 up until 2013. And what the results of the study showed was that while the rate of colon cancer is declining in the over 55 age group, it's actually increasing in patients under 50, and most especially in the age group of patients from 20 to 39.
Wow.
All right, so this has been seen in other studies, but it's not really been highlighted. It's kind of been under the radar in terms of the reporting of this. The New York Times and other news media came up with this at the end of February, and it was splashed all over the news media.
Any idea as to why? Why the increase?
It's speculative. The answers are, we don't fundamentally know. What is suggested is that diet or poor diet can play a big role in change of your, basically the biome, the kind of nature of the makeup of your intestine. And there are other risk factors that would include diabetes. Obesity is also talked about. Excessive alcohol use, cigarette smoking, things that are known about but don't fundamentally know. It would be suspected that a lot of this stuff would be genetic, right? You would think if it's occurring in younger people, but genetics were only involved in about 20% of these cases.
That is so interesting. Dr. Kenny, can you just remind everybody, what are the signs and symptoms of colon cancer?
Well, absolutely. Sadly, colon cancer frequently grows without any sign or symptom. That's what makes it, unfortunately, something that we need to screen for when you're asymptomatic. But if symptoms develop, they typically will develop once the cancer's grown a bit larger, and it can be bleeding from the rectum. So even when you're wiping, you might see blood in there or blood in the toilet water. Sometimes abdominal pain, weight loss, change in your bowel habits or narrowing of stool, or symptoms of anemia such as fatigue, lack of energy. So kind of subtle symptoms and things that probably a lot of us feel from time to time. So,
and this is for both sexes, for both
correct.
Men and women.
It affects men and women equally. It's the second leading cause of cancer death overall, and third leading cause of cancer death for men, third leading cause of cancer death for women. So it's prevalent, and we definitely can make an impact by catching it early.
Okay, that's so important with all cancers, right?
Absolutely.
But this one sounds especially difficult because you may not notice the signs, or I bet a lot of people ignore the signs, or they put off going to the doctor. You know, I hear a lot about that. You know, people just, you know, they're too busy with life.
Well, they're not eager to run in and have a colonoscopy, that's for sure. But I would say that the emphasis that we want to make this morning is particularly on the young folks. We want them to know that it's never okay to have persistent rectal bleeding. It's not okay to have bowel symptoms. And if you have them, you need to talk to your doctor about them. You needn't just say that there's something that can be ignored. When you look at the data, about 80% of these young age folks diagnosed with colon cancer are diagnosed at an advanced age. And that's quite different from the cancers that we're diagnosing in the over 50 age group. We're diagnosing those people at earlier stage of cancer. And outcome prognosis is directly related to the time where we make the diagnosis. So delay in diagnosis, poorer outcomes.
Sure.
So we want to get these folks to to just be more conscious of the symptoms and not say this is a disease of older people. It's a disease of all people. And I think we, as an organization, they're looking at now trying to reassess. Do we need to reassess when we start screening folks? Because it starts at 50. That's when that's what everybody thinks. I don't need to have anything done until I'm 50. But it looks like that may not be the case.
You bring up a good point, because I'm thinking if someone in their mid-30s, early 40s, if they're seeing these symptoms, they may think, well, it couldn't be that because I'm too young, right? And then they don't get checked. So the message here, folks, is you're not too young. It sounds like, again, younger people. That's what the study found.
You're not too young. And I think the one other thing that I wanted to point out is that, let me see if I can put this in perspective. So if you were born after 1990, the rate of you developing in your lifetime colon cancer as compared to somebody born after 1950, it's 2 times higher for colon cancer and 4 times higher for rectal cancer. So these are lower left cancers or rectal cancers, and they are very much in reach of the type of instrumentation that we have. So people needn't fear coming in and being evaluated for these symptoms. They shouldn't.
And the survival rate, like you said, is so much higher if you get screened and you catch it early.
Oh, no question about it.
Absolutely.
Yeah.
Thank you both so much for being here. Again, you're with the Windward Digestive Health Center. You guys do a lot of great work there. We hope that our viewers will look you up online. We're going to have all of your contact information on our website. And so if people have further questions or on how to get screened or anything, they can give you a call directly.
Great.
So thank you both for joining us.
Thank you.